Hi, I'm Erica, and now we will tackle about health teaching to aid pregnant women. First, we will tackle about nutrition. Healthy eating is always important, but especially when you're pregnant. So, make sure your calories come from nutritious foods that will contribute to your baby's growth and development. Try to maintain a well-balanced diet that incorporates the dietary guidelines, including the lean mix. Kagaya neto ng beef, pork, and chicken. Then, benefits of good nutrition kasi sobrang helpful neto para sa baby na nag-grow sa tummy ng isang mother. Then, adequate rest kasi kailangan ng mother ng sapat na pahinga para hindi siya makaramdam ng hindi naman sa sinasabing hindi na siya makakaramdam ng hilo dahil isa yon sa mga signs and talagang nararamdaman ng isang mother. But, kailangan nila yon para ma-lessen yung mga nararamdaman nila. Next is yung good hygiene ng isang mother. Kasi, pag once na yung mother is poor hygiene, pwede itong mag-promote ng hookworm infection, which is cause maternal anemia. Pwede kayong magkasakit dahil sa poor hygiene. Then, next is, which is linked to preterm births and low birth weight. Siyempre, ayaw naman natin na mangyari yon sa baby na dinadala nyo. Kaya dapat iwasan natin yun and also mas maging maalaga tayo sa katawan natin. Now, we will tackle about smoking and also alcohol drinking. When a pregnant woman drinks alcohol, the alcohol passes through the placenta and can affect the baby's development. This happens throughout this pregnancy, not just in the first few weeks. Kaya kailangan, pag once na nalaman mo na pregnant ka na or before, dapat iwasan na yung pag-inom and also pag-take ng cigarettes. Smoking during pregnancy increases the risk of health problems for developing babies. Dahil pwede rin silang magkaroon dahil sa mga ginagawa mong bisyo or vices and mahihirapan na lumaki at mag-growth yung baby sa tummy mo, including preterm birth, low birth weight, and birth defects of the mouth and teeth. Smoking during and after pregnancy also increases the risk of sudden infant death syndromes, which is yung SIDS, na karaniwan nangyayari after ng pagpapanganak sa baby. Yung hindi malaman na pagkamatay ng isang baby. Parang sinasabi na natutulog lang siya pero namatay na walang any kinds of reason. Dahil yon sa mga bisyo na tinitake ng mother before, habang pinagbubuntis pa lang siya. Then, also yung premature birth, kasi hindi siya fully developed. Hindi siya nabibigyan ng sapat na food and also sapat na time para mag-grow. Kasi naharangan siya ng mga bisyo mo. Then, low birth weight kasi premature, mababa yung timbang. Hindi niya naaabot yung normal. Then, impacting on the physical and mental development of the child, a condition known as fetal alcohol syndrome. Next, we will tackle about the employment. May question ako dito na, when should a mother start a prenatal care? Your first prenatal visit will generally be around 8 weeks after your last menstrual period. Because we all know that the mother is working, that's why we also consider their schedule. Pregnancy can affect your safety as a worker. If you are pregnant, we encourage you to discuss possible job hazards with your employer, health and safety office at work, if there is one. Many pregnant women are able to adjust their job duties temporarily or take extra steps to protect themselves. Tama yun kasi kung alam naman natin na mas makakabuti yun para sa baby na dinadala, dapat talagang i-limit or may service na yung pregnant women papunta sa work and also pa uwi para hindi na siya mahirapan sa pag-transport or pag-take ng transportation pag-uwi. Then also, current occupational exposure limits were set based on studies of non-pregnant adults. What is considered safe also, kailangan talaga yung safety ng pregnant women. Hindi natin maaalis yan as a nurse. Pregnancy can sometimes affect worker safety. Dahil alam natin na yung pregnant women, medyo hirap na yan sa paglalakad, tsaka kailangan may alalay sila lagi para hindi sila matumba. Kunyari, pag masikip, hindi sila pwedeng makipagsisikan kasi hindi pwede silang maipit kasi may baby na sa tummy nila. Then, marami na rin silang nararamdaman kagaya ng madaling pagkapagod, pagkahilo, and sometimes pag magsi-CR sila, magulat na sila, masusukan na rin sila. Siyempre, di ba, sobrang hassle yun. Kailangan alam mo sarili mo kung kaya mo pa na mag-work. Next, we will tackle about sexual activity. I have a question. Sabi dito na, is it okay to have sex during pregnancy? Your developing baby is protected by the amniotic fluid in your uterus, as well as by the strong muscles of the uterus itself. Sexual activity won't affect your baby as long as you don't have complications such as preterm labor or placenta problems. Can sex during pregnancy causing a miscarriage? Having sex during pregnancy won't provoke a miscarriage. Most miscarriage occurs because the fetus isn't developing normally. Sinasabi dito na yung fetus hindi siya makapit, kaya nagkakaroon lang talaga ng miscarriage dahil sa mga ganong instances. Next, we will tackle about emotional support. All women experience pregnancy, both emotionally and physically. Then, during the first trimester, a woman's feelings are related to physiologic changes, kagaya ng nausea and fatigue. Then, whereas during the last trimester, anxiety related to the approaching birth becomes the predominant emotion. A woman's socio-economic status, her number of previous births, and her personality type can affect the extent of these emotions, as well as her ability to cope with them. That's why, as a nurse, we are here to listen and give advice if needed. Tayong mga nurse, lagi lang tayo nandyan para makinig sa patient natin. Then, kung pwede tayo mag-advise, yun. Mag-advise tayo para makatulong sa mga ninakit nila sa buhay. Then, next is, para naman to sa mga father, mga aspiring father. Yan, may tanong siya. Sabi, how can I get emotional support for my pregnant wife? Madali lang yan eh. Kailangan maging get involved ka dun sa situation na wife mo. Yun lang. Because one of the main ways to show support is simply to show up. Go to all medical appointments your partner has. Kailangan samahan mo siya sa pagpapacheck up niya sa OB para alam mo yung mga nangyayari sa asawa mo. Kung bakit siya moody, kung bakit niya nafe-feel yung mga bagay na yon, and also, bakit ganun yung actions niya sa araw na to. Hindi ka magtataka kasi you have a knowledge para i-understand yung situation ng partner mo. Next, we will tackle about the physical activity. Healthy pregnant women needs at least 2.5 hours of aerobic activity like walking, swimming each week. Sobrang nakakatulong to para sa pag-circulate ang blood ng isang pregnant women. Hindi lang naman sa mga pregnant women, kahit sa atin na normal people na kailangan talagang mag-exercise and always laging gumagalaw para hindi tayo matenga. And also, regular physical activity can help reduce your risk of pregnancy complications and ease pregnancy discomforts like back pain. Kasi pag once na binibaby natin yung sakit natin, kahit hindi sa mga pregnant women, yun, talagang sasakit yung mga kung ano nung katawan mo. Siyempre, lalo sa mga pregnant women, pag once na hindi siya naglakad-lakad, kung hindi siya nag-exercise, then mas mahihirapan siya kasi mas mapipil niya lahat ng bigat. Kasi lagi lang siya nakahiga, mas mapipil niya lahat ng pressure sa back pain niya. And also, is it safe to exercise during pregnancy? Then, if you are healthy and your pregnancy is normal, it is safe to continue and start regular physical activity. It is advisable also. Physical activity does not increase your risk of miscarriage, low birth weight, or early delivery. However, it is important to discuss exercise with your obstetrician. Kasi baka may mga complications ka na gagawin mo tong exercise na to, but hindi pala capable for you. Then, if your healthcare professional gives you the okay sign, and also to exercise, it's a big thumbs up na sobrang makakatawa dahil opportunity mo yon para hindi ka magkaroon ng mga sakit-sakit sa katawan mo. You can discuss what activity you can do safely. Pwede kang manghingi ng advice and also kung ano mga pwede mong gawing exercise na light lang para hindi naman sobrang mapagod yung katawan mo, but to feel relieved and relaxed. Next, we will tackle about the discomforts in pregnancy and how to manage this. About half of all pregnant women experience nausea and sometimes vomiting in the first trimester. This is also called morning sickness because symptoms are most severe in the morning. Some women may have nausea and vomiting throughout the pregnancy. Ma-advise na maibibigay ko is avoid heavy meals and spicy, greasy, sugary, and acidic foods. Stick to a bland, high-fiber diet. Kailangan kakain ka ng mga beans, vegetables, mga lean meats, ganyan. Drink lots of fluids, syempre. Kahit hindi naman pregnant woman, kailangan uminom lang ng plenty of water. Sabi nga ni Mimia, drink your water, bitch. Sure. Then, next is exercise daily. Small, frequent meals may relieve some of the symptoms. Don't lie down right after a meal. Hindi naman pwedeng sabihin mo na healthy yung kinain ko, then next is mag-shit ka, kain ka ng kung ano-anong bawal. na natin yan. The next is, does being upset during pregnancy affect the baby? Then, high levels of stress that continue for a long time may cause health problems like high blood pressures and heart disease. During pregnancy, stress can increase chances of having a premature baby and also the low birth weight. Kaya, dapat lagi lang natin i-maintain yung mga nakakasanayan natin. Hindi pwedeng biglang magbabago ka sa ibang routine, masabi lang na nakikisabay ka. Kailangan, as a pregnant woman, maging responsible because hindi lang naman na ikaw, mag-isa lang yung may buhay sa'yo. Pati yung baby na nasa tiyan mo. Kaya always be responsible sa mga actions na gagawin mo. Yun lang. Thank you po.